owners of this land, the Wajjuk Nyunga people, to pay respect to those who have passed before us. I extend that respect to the Aboriginal and Torres Strait Islander people here today. On behalf of the Mental Health Foundation Australia and our chairperson, Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending our launch of National Mental Health Month 2021 in Western Australia. And I must say, it's the first one here, so it is kind of a big deal. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring all Australians together in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond through a series of various mental health related events. National Mental Health Month is a program that the MHFA is extremely proud of, and we intend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health its due attention, and that is exactly what the MHFA is wanting to achieve. Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year, the theme of National Mental Health Month is Post-Pandemic Recovery Challenges and Resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Every individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery and fostering resilience, #resilience and recovery. Please join us in celebrating the Mental Health Foundation Australia by viewing this really sweet short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Resource and take up the well-being app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Resource for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board of directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
How wonderful was that? I'm just going to insinuate it was wonderful. So on to the next part as we continue the program. I would now like to invite Anne Donaldson, Board Director of Mental Health Foundation Australia, to welcome you all. A few words about her. Anne is a professional non-executive director with over 15 years of experience on state government and not-for-profit boards, as well as state national government committees. Having worked predominantly in health and human services, Anne has extensive experience in disruption and change management in executive director roles. Anne understands the process of resolution in consumer grievances and has detailed knowledge of strategic and compliance issues. Anne brings over 30 years experience in metropolitan and regional Western Australia in senior management with an understanding of capital works, financial and operational governance. Her roles include community and stakeholder engagement. She has successfully facilitated complex discussions to achieve consensus and shared agreement of service contracts and program delivery. Please join me in welcoming Anne.
Yes, you can see I've been around for a few years. I would like to recognise the traditional owners on the land in which we're meeting tonight, the Whadjuk people of the proud Noongar Nation, their elders past, present and emerging. I would like to especially recognise, and let me see, Jasper Stojkovsky. Pretty close, and I do apologise. And to all of our special guests tonight, it's wonderful to have you here at this launch. It's the first of a number of events that are going to be held this month, and Ritika will take you through those at the end of the session. Everyone's special, but I would really like to acknowledge the multicultural ambassadors that have been working with us here in this state. Mental health means many different things to many different groups, and it is so important that as a community we start to understand what it means to us, but also what it means to all of our other people within our community. And our multicultural ambassadors have really helped to open my eyes, and I think many of our eyes, around how to build a conversation and to understand the nuances of what mental health means in different communities and what well-being means, because we all carry different messages. And if we're going to make a difference, we need to understand how to unite those messages and those conversations so that we can make a difference. So I would really like to acknowledge the work that they've been doing and how they've actually taken us into their communities in many different ways to help us understand the many different special messages that we need to be picking up. Today I was sitting on a research committee, ethics committee, and what's really interesting is to understand that participation is not just about being done to, it's about being engaged in, and so it's so important that we understand that art of engagement and what it means, and the art of listening. So this year the theme for the Mental Health Month is post-COVID. Well, I don't know that we're there yet, but you know, we're trying very hard. Post-COVID recovery, its challenges and the resilience that it's going to bring for many of us. I've worked with a number of women who've been trying to get back into the workforce on a volunteer basis. And what I've found is that for some of us in the community, it's been a really tough slog these last couple of years. But for some people, it's actually opened up new pathways, and people have dug deep to try and understand how they can meet the challenge of what's in front of them. And it's not always easy. We've all been there, we know what it's like. But I hope with this coming year that we can understand how we can really build that resilience and that move ahead space that so we can make a difference in our community, and we can actually learn from what's actually happened to us in the last couple of years. So I would like to now hand back to you and we can sort of move forward. So thank you.
Sorry, she took my little papers. Here we are. Thank you, Anne, for your wonderful support and your insight. I would now like to invite Jasper Stojkovsky, MLA, Parliamentary Secretary to the Minister for Transport, Planning and Ports. Jessica is also the Labour member for Kingsley, Western Australia. Please welcome Jessica Stojkovsky.
Kaya everyone, I would also like to extend pay my respects and acknowledge the traditional owners of the land on which we're meeting today, the Budja, right next to the Derbil Yerigan, which is for people that have learnt more recently the Swan River, but what we know is the Derbil Yerigan to the Wajak people that walk the land here. I'd also like to acknowledge three of my parliamentary colleagues that are here. We've got Colin de Grassa from the Upper House. What's your region, Colin? From the Agricultural Region. And we've also got Stuart Aubrey, who's the member for Scarborough, and Jane Kelsby, who's the member for Warren Blackwood. I know, I'm getting there. I just always put them around the wrong way. But I think this is a great testament to show how important members of Parliament believe mental health is. And I think this is one of the things about your resilience theme this year. It's really important in a post-pandemic world as we talk about resilience. And one of the things I talked about last year when I was going to graduations, because the new members of Parliament get to realise that their whole October and December is taken up by graduations. But you attend a lot of graduations, and I said to a lot of the kids that were graduating in years 6 and year 12 last year that they're actually lucky in a way. They will forever be known as the pandemic graduates or the COVID graduates, but what they lost because of COVID, they actually gained as well. And I say to them to stick with me on this story, and I'll ask for you to do the same. They remind me of the opposite of the Biome Project in the UK. Now, the Biome Project in the UK was a scientific program where they created the perfect conditions, the perfect soil nutrients, the perfect amount of sunlight, the perfect amount of rain to make sure these trees grew and foliage as strong as possible. But what kept happening is that certain tree species would get to a height and then they would fall over. And they couldn't figure out why these tree species kept falling over. What they eventually realised is that they hadn't put in any wind. They hadn't put in any resistance. They hadn't given these trees any reason to create a foundation to keep themselves strong and keep themselves upright. And I say to these kids that you're the opposite of this, because you have lived through a pandemic. You have gotten through a whole year of schooling, particularly year 12s, a whole year of schooling which everyone tells you is the most important year of schooling in your life, and you had to do it during the middle of a global pandemic. So you've now had the resistance, you've had the capacity to build the resilience that you need to make your foundations so that when life throws curveballs at you, and believe me it will, you have those foundations, you have that strength to tap into. And so I think it's really great what you're doing here this month and moving forward, because we do need to talk about resilience, but we need to talk about mental health in a way that we're not addressing mental health issues as issues. We actually need to talk about mental health as something that we all have to take care of, just like our physical health. I know my job and many of the jobs in here can be really stressful and really time consuming and leave very little time for family and fun. And so having the conversations around how we look after our mental health when we're healthy actually helps us deal with how we look after our mental health when we're not. And so one of the things I learned, and it took me a good couple of years as a Member of Parliament, was that I actually had to carve out some time for myself. And so I know that you're all here because you're interested in mental health, and I am by no means an expert or even knowledgeable in this area, but I can tell you from my own experience as somebody who is time poor, has a family, has a job, has kids that want to do sport all the time, the best thing I can do for my personal mental health is carve out some time for myself, whether that's going to the gym, going for a walk. Those things are good, the physical things are good, but finding something that I love was actually what got me through really bumpy times over the last few years. I'm quite musical. I can sing to varying degrees of, I'm not going to sing for you now. I can sing. I learned to sing when I was a child and a teenager, and I just love music. But I always regretted never learning the piano. And my daughter was learning piano, and so I just decided one day, you know what, I'm going to go get piano lessons. And I'm going to do it during a time where the kids are at school and I don't have to be there for them. So I went during work time and I didn't feel guilty about it. And the reason I didn't feel guilty about it is because as members of Parliament, we work 50 to 70 hours a week. For me to take 1 hour off every fortnight, it's not a big ask. And what I found was actually it gave me a coping mechanism. At home, when things did go bad, I could just sit down and play, badly, the piano, and just calm myself, and it really helped to clarify how things were going in my life and what I could do to fix the issues. So I want to commend you for this amazing initiative that you're going with. Resilience and self-care when you're healthy is as important as caring for yourself when you're not. So congratulations, and thanks very much for having me.
Thank you so much, Jessica, for being with us today. And I completely agree when you said we should take care of our physical body, and we are so strict on that, you know, having our workout regimen and how we eat and what we eat, but we forget the mind is also an organ of the body at the end of the day. So I really love that. And on that note, I would love to welcome the rest of the Member of Parliament as well. Thank you for coming out and supporting us. It means a lot, more than you would ever know, trust me. I would now like to invite Dr. Samir Hebley, and I'm going to just tell you a little bit about him. Dr. Hebley is the Medical Co-Director of North Metropolitan Health Service, Mental Health, Public Health, Dental Services, Adult Mental Health Patients, Grey Lines Hospital, Sir Charles Gardner Hospital. Dr. Samir is a consultant psychiatrist and a senior medical leader. He's passionate about mental health advocacy and believes in a holistic bio-psychosocial, cultural, spiritual approach to healthcare. He's also a strong advocate for person and carer-centered integrated care approaches. Dr. Hebley is also a linguist, writer, artist, and poet, and believes in the grandeur of every moment and every interaction and for nurturing our beautiful universe. I'd like to welcome Dr. Hebley, please.
Mental Health Foundation. We want to acknowledge the traditional owners as well as you all guests here today. So mental health, the month of October, it's another important opportunity for all of us to acknowledge our mental health, to acknowledge all our feelings. It's okay, we don't have to be happy all the time. It's important to acknowledge that we can be happy, we can be sad, we can be angry, we can be frustrated, we can feel trapped, we can feel chaotic, and all this is part of being human. So I think I want to reinforce that it's okay to experience all these feelings because they are quite normal. It's also important to acknowledge that it's important to seek help when required. And I want to acknowledge the Mental Health Foundation and all the non-governmental organizations and the governmental organizations here who are doing their very best to help people with mental health issues as well as other issues. So the pandemic has been a trying time for all of us. We are seeing a lot of anxiety, depression, stress, psychological disorders, as well as issues with housing, accommodation, economy, friendships. But I think Mother Nature has been tired. And I think it has been an important pause for all of us. And it's been an important time for all of us to perhaps take a pause and think about where we are now and where we are going, both individually as well as a nation and as a universe. Yeah. It's perhaps time to reprioritize our lives and see what is it that matters most to us. As I was thinking about what to say this afternoon, I thought I would use my poetry. So I did write this poetry this afternoon on how a post-world pandemic is going to look like. Yeah. So I just want to share this poetry I wrote this afternoon for all of you. A novel virus, a new way of living. Our lives have changed. It's a new way of being. Despite some challenges, I see new rays of hope, healthier ways of living, and organic ways to cope. COVID has taught us the power of simple pleasures, fresh air, sunshine, and morning walks. These are our greatest treasures. The pandemic has been a wise teacher, encouraging us to take good care of our health. A fit body and mind, this is our greatest wealth. It's time to take stock of our lives and priorities to renew, to learn to nurture Mother Earth and virtues anew. I see a kinder world where humanity will be valued, where values will renew, where compassion and empathy will trump and be at the core of everything we do. On that note, thank you very much, Mental Health Foundation, and all of you here.
So much, Dr. Headley. And what I'm starting to realize is a lot of our speakers have hidden talents. I wonder we need to have maybe a different kind of a night to honor mental health. And our next speaker also has a lot of talents. I would now like to invite Kylie Pearsall to share her personal journey with mental health struggles with us. Kylie is the Health and Wellbeing Program Lead for Biome, using her various qualifications in physiotherapy, sports medicine, rehabilitation, injury prevention and management, fitness, yoga, and mindfulness to holistically support corporate and corporate individual clients. Kylie is also a multicultural ambassador of the MHFA here in Western Australia, and she's also a DJ. So please welcome Kylie with me.
Thank you. So this year's theme is actually quite close to my heart because during the period where we were in peak lockdown in WA, I was working in, fly out. And some of you may or may not be aware, but one of the things that happened for a lot of FIFO workers, especially those that were crossing state borders, was that they actually got effectively stuck in Western Australia. So there are some guys that I was working with on the facilities that I was engaged with as a wellbeing support who actually still haven't been home to New South Wales since the beginning of COVID. So it's one of those things when we talk about post-pandemic, and I agree we're not there yet. Right? We're definitely not post yet when we look at the Eastern Seaboard in particular at the moment and the vaccination rates that are still lagging. So at the moment we're not post, and when we talk about resilience and building those roots from those challenges, most certainly. But one of the things that I noted, and how many of you in here are working in support roles or mental health roles or wellbeing roles? Yeah. How did you guys cope? Like, during that process. So I was working on 2 oil and gas facilities in the middle of the ocean, and everybody was coming to me with their upsets and their frustrations. And you spoke to economic impacts, Dr. Hebley. So a lot of the redundancies and restructuring that companies chose to do during that period had huge roll-on effects to people's health and well-being and their mental health. So over that time, I started to find myself feeling more and more stressed, more and more anxious, not because anything was happening to me, just because of what I was surrounded by on a daily basis and the stories that I was hearing on a daily basis. So one of the things I then chose to do, speaking of looking after yourself when you're well, was actually to take up a mental health referral, a mental health care plan, and actually get the support of a psychologist to manage not what I was feeling, but what everyone around me was processing. So each time I'd come home from my offshore swing, I would go and see a therapist. We would download, debrief, talk about all the stories that I had heard, how I might best be able to support people in my role. Because strictly speaking, as a well-being person, I was there as their physiotherapist. I was there as an injury prevention specialist. I'm not a trained mental health practitioner. I am still at least a year away from my provisional psychology registration because I'm back doing a postgraduate. That was one of the things that came out of the pandemic for me, right? But making sure that I looked after myself during that period of time, having somewhere where I could be in a safe place to talk about all of the different feelings that I was feeling, all the different things that were arising in my immediate sphere. So when we talk about post-pandemic challenges, I think there's also space for us to talk about how are we going to process everything that went on in our individual sphere, but also collectively. There's still a lot of grief and upset in the wider community, even if we personally haven't been affected. So it's something to consider and something to think about when we look at the post-pandemic challenges and resilience, is actually how are we going to process all of the things that are happening collectively as well as individually. Thank you.
Thank you so much, Kylie, for sharing your experience with us. I would now like to introduce Peter. Peter is a psychologist, author, and thought leader in mental health and performance. She has held Senior Vice President, Managing Director, and Executive Manager roles. She was the founder of Australia's biggest mental health check-in and was the MD of one of the first companies in the world to use biometrics for measuring mental health. Peter is also a co-founder of the 1 Million Lives Initiative, partnering with Jacobs globally to use science, technology, and the power of each other to change the way we think about mental health. Please join me in welcoming Peter.
confession to make, which is that I have no talents. I can't write poetry, I can't dance, I certainly can't sing, and I wouldn't do that to you even if I could, because we're trying to work on our mental health and not make it worse. But it is a pleasure to be here telling you and talking a little bit about an initiative that it has been really a professional highlight and very exciting for me. I've been a psychologist, a practicing psychologist for 25 years, and like so many people in our profession, I've thought a lot about how I can be helpful over that time. I think Australia underrates itself really as doing more than anyone in the world to move beyond the concept of awareness. Ultimately, Australia does awareness better than anybody else, but the ability for us to move beyond awareness and start to move with, I guess, the data that we're collecting around mental health is something that we have and can continually become leaders in. I could tell you a lot of stories professionally around the evolution of the 1 Million Lives initiative and the app that I'm going to overview for you. But the most easiest thing is to tell you a personal story, and that is that, again, in a quarter of a century of working with people, night and day, hundreds of people, families, individuals, professionals, a lot in the employment, workplace and EAP space. When I had a master's degree and then I experienced a mental health issue, I didn't pick it. And I think one of the things that is really humbling for me about that is to recognise that, people know, as I often say, if Australians were in a quiz show and had to answer 4 symptoms of depression or anxiety in order to, win the car, we would win the car. Like we know how to answer those questions. But the issue around mental health is that quite often it's something that happens slowly for people. It happens gradually. We don't wake up with a wry neck, we don't have a wound or a broken bone. And the brain's designed to continue to adapt. So if you walked into a room and you thought it was particularly dim, or you walk into a place and you can smell an air freshener or an incense, after a while you can't smell it anymore, right? The brain adapts and says nothing to see here until your partner runs in and arrives and says, "What's that smell?" And you're kind of like, "Can't smell it anymore," because the brain's designed to continue to adapt. So what happens is when most of us start to experience symptoms of depression or anxiety, we don't actually think, "Oh, I actually am experiencing depression." We just think, it's just that it's tax time, it's just the end of the financial year, it's just the pandemic, it's just that I haven't been sleeping lately, I think I'm a little run down, and before we know it, it's a new normal. So what we know is that when I first launched Australia's biggest mental health check-in, and we asked people, what is it, have you ever experienced a mental health issue, or are you currently? This was entirely confidential, through an app, digital space, no identification. People said no. And then when we went and set answer these questions, as you can see up there, of the people who were in these moderate or severe categories in terms of clinical diagnoses, 70% of males in moderate and severe diagnoses areas had answered no, I'm all good at the beginning of the survey, and 58 or 56% of females. So for an issue, mental health is obviously, as we all know, and I'm certainly preaching to the conversion, as an issue that we know is one of the most significant issues globally facing humanity, and we were the epidemic before we had the pandemic in terms of mental health. We don't measure mental health anywhere in the world. We don't measure people until they get sick and then move into the doctor's or the psychologist's office. And yet, again, I turned 50 this year. I've gotten a letterbox full of free mammograms and pap smears and heart checks and bowel check collections and you name it in there. Nobody's asked me for a mental health issue, which is just about more likely to, or is more likely than any of those issues to significantly affect me. So as a practicing clinician, as I said, I found that when people come into a psychologist's office, nobody ends up there by mistake. Nobody's just wandering in and just sort of see what's going on, to see if they like, Reiki, or they might sort of appreciate hot yoga or anything like that. By the time people are in a psychologist's office, they are in desperate need of being in a psychologist's office. Usually many, many years have passed, and usually many, many people have tried to get them there. So for me, one of the key issues was how do we actually go to people before they end up in mental health facilities and care professions, and how do we also encourage, and we talk a lot about stigma in mental health, but for me the fastest way to remove stigma is not to make it a club that you are only ever in when you have crossed the line. So if we're all checking our mental health and we're all measuring it the same way as we measure just about everything else known to mankind on our smartwatches these days, if we're all measuring it, we're all checking it, we're all talking about it, we can start to see the trend changes, and we can start to educate, we can start to remove stigma, and we can start to recognise that we're all sort of somewhere on the spectrum at some point in time between absolutely at our best and barely being able to get out of bed and function. When I launched the Australia's biggest mental health check-in in 2017, it was a chance to kind of go out to workplaces initially and say, can everybody do a mental health check, not just to figure out whether people are sick or not sick, but the first level of it was what is the what do people sit at on the K10, so in terms of their psychological distress. The second one is, instead of saying, yep, you can go, you're all good, you know, when you go through customs and you get to just go the fast kind of route and go, yep, nothing to see. If people have a good score on the K10 and they're in normal ranges, great, let's actually talk to them about the risk factors, let's talk to them about how's your sleep going, how's your resilience going, how are the personality traits that we admire are also able at times to be a two-edged sword. So I developed an app and some software, my team and I, to look at, as I said, psychological distress, then things like resilience and sleep that we can expect to be low before psychological distress increases, and then what are our coping strategies, what's perfectionism, what's our work satisfaction, and what's our exercise and physical health, and those sorts of things. In 2019, JACA is a global organisation. They had put their people through the mental health check-in, again, people who are well, and they said to me after a conference in Dallas in Texas, they said, everyone should do this and not everyone can afford this. If you will build us a free version of it, what we would like to do is fund it and help it get out to as many people as possible. And so the 1 Million Lives Project was born to try and get 1 million free mental health checks throughout the world. So presently we are engaged in a process that, as I said, the campaign, which is certainly, I'll talk a bit about next steps on this in just a second before I finish. The aim, first of all, is to reduce stigma by saying this is not something for when you are sick. We need and deserve to be checking this, all of us together. The second element was starting conversations. So what we've found is particularly powerful in terms of the initial data that we're getting is that males are checking in more commonly even than females. So we're getting males with a clinical grade, empirically validated scales that instead of having to walk into a doctor's office because their wife has left a mark on their earlobe and then say, oh, I don't know, I'm tired a lot and my wife thinks I don't sleep and I'm grumpy, and then we go through thyroid checks and all of the things that we need to do before we start to kind of have a look at, well, actually, what's that really about? It means people can walk in with a score and say, I don't know, like I did this, and instantly the GP or their friend or the EAP or whoever it is can say, oh, what's this? Oh, that means that I spend a lot of time on social media, and when I get off it, I feel worse than when I started. That means that when I'm stressed, I don't have many social supports. This score here, that means that I like my standards to be really, really high, like all the time, regardless of whether I have the time or the resources to complete things, everything at a high standard. So the aim was to be able to start conversations rather than have people have to find the words in many cases. The other thing is, and again I'm preaching to the converted, but the data that we need to present, that we need in terms of keeping ahead of mental health issues in the community, is it means that we can't necessarily wait until Australia or any other country gets their official statistics that kind of come through sort of years down the track. So if we want to get in front of the curve, we need to start to say what is happening. So we have, and this is too long with the results, but I'm geeky enough to hang behind and go through what trends we're finding. The trends that we're finding, which are not a surprise, are that globally, doesn't matter what country you're in, your mental health is worse, your resilience is worse, your social media scores are worse, your perfectionism is worse, the younger you are, the curve looks like this. So we need to start saying, instead of let's educate everyone about things like depression and anxiety, let's educate people about understanding those first signs. That I was talking to somebody last night about their social media use, and I said, when you get on social media, how do you feel? And they said, yeah, this is a highly accomplished professional, and they said to me, yeah, it's awesome. I can be flat out all day, and it's kind of nice just to flick and do something unproductive just to wind my brain down. And I said, awesome, what happens? And they said, well, it's awesome. I check this and I check that. And then if you look at it, the curve goes from, oh, this is nice, to now I'm just flicking, and it's pretty meaningless. And I actually feel worse than I did when I started, but I notice I'm still on it. And also, by the way, I've lost another hour and a half sleep, so I might have otherwise lost. So looking at those kind of levels are important. So we can start to get really literally live insights. We measured 4,000 people recently, and within 24 hours we know exactly what the demographics are doing on those 4,000 people, and we can have a conversation with the industries and the sectors and the wellbeing providers and say, if anybody can do anything on sleep management in this age group in these professions, go for it, and then we can obviously retest. Personalised strategies as well. One of the things around the One Million Lives campaign is that this is not about giving a professional a secret scorecard. You don't fill out a form, give it to the doctor, and the doctor says, aha. This goes back to the individual. In fact, I wrote the app. I can't see anyone's scores. I have to say to people, would you mind when you've done it? You just send me a screenshot so we can have a conversation about the results. This is designed for individuals, not just to get a score, but to get a, oh hey, the algorithm is written so that if you have had a history of mental health and your sleep's down and your exercise and your alcohol and your coping strategies are primarily social withdrawal, it will say, hey, this is the first thing you need to do. It will give people a customised plan and resources and crisis contacts. And so forth. And then obviously we can start to sort of do industry changes and look at those particular demographics. So the One Million Lives app is a 7-minute mental health check. It is free, it's downloadable. We'll send you the QR code, and if you haven't already seen it, it's on there's a oml.world website. And what it is it's inviting people to kind of check in and just increase the tally so that we can start to tick over towards 1 million lives. We would encourage people to sit down and do it in their work teams, to do it, as a safety moment, to do it if you've had a difficult week and you work in a hospital, or if you work in government or you work in the private sector, to take that sort of 5 minutes to sit down and say, everybody just breathe, grab your device, do your own little check for a second, and then how's everybody going? Do you all want to talk about where they're at? And ultimately it gives people, every time you go on the app, it gives you a list of how your scores have changed over time, so people can track those and they can see that, if they're starting to travel more, that is a contentious statement. But if people are starting to travel more, and they can see that their sleep is sort of going downhill along with their mental health. So it's an exciting opportunity, the campaign. We are launching in the resources sector next week in terms of particular groups, just on construction industry, and globally we have got a number of initiatives rolling out in different countries. Anne and the Mental Health Foundation have been supporters, I think, in terms of anything that is usable, that is helpful across different multidisciplinary and multicultural kind of settings and contexts, and is increasing the awareness as well as the proactivity around mental health. So they've been fantastic in helping us get the word out about the check-in. I don't know if there's any questions, or otherwise I can answer those later on. other than that, thank you sincerely for having me along tonight to talk about One Living Lives, which is, as I said, a completely free pro bono initiative and will only get circulated by people like us, continuing to talk about it.
I just want to acknowledge Peter for being here. I've just come from hospital, so not for herself, but a family member, and I just really appreciate it.
Thank you.
Thank you so much, Peter. That was a very, very insightful app, but also knowledge about it. Now we're going to do a little bit of a fun presentation. Wait. It's going to happen. Okay, bear with me. We're going to present our Mental Health Awards. Each year, during National Mental Health Month, Mental Health Foundation Australia recognises and celebrates the achievements and contributions of individuals, organisations and groups working tirelessly to stamp out stigma and raise awareness of mental health. Mental Health Awards are awarded to those who have demonstrated a significant contribution towards a positive mental health in their community, to those who strive to inspire and act as role models for the community to look up to. We have two wonderful recipients in Western Australia this year. We will begin by announcing the Advocate of the Year, who is Nick Hudson. And I'm going to just say a few words about Nick. Nick is the founder and CEO of the Push-Up Challenge, Australia's largest fitness-based mental health event. Starting off as a fun pursuit with a few mates, in just 5 years, Nick has built the Push-Up Challenge into a national event. Since its inception, the starting off as fun pursuit event has engaged over 250,000 participants and has raised over, wait for it, $16 million for mental health. It is now one of the country's leading mental health campaigns. Being inspired by his own experience with depression, Nick is a strong advocate for mental health. An engineer by day, Nick is an active member in his community in various aspects relating to health. Please welcome Nick to say a few words.
Thank you very much. Usually when I get up in front of a crowd and having been introduced as the fan of the Push-Up Challenge, I sense this anxiety in the crowd. So I'm going to ask people to do push-ups. Fear not, no push-ups tonight, okay? 10 or so years ago, I knew nothing about mental health. And I still remember the moment where I found out about my dad's own journey with depression, and I was introduced to this whole new world. When I started the Push-Up Challenge, it was literally myself and a few mates looking to have some fun. Being a bit of a tech nerd, as I am, I decided to develop a little app for us, which cost about $200. I would never have guessed that we would grow as we have, engaging hundreds of thousands of Australians through education, connection, physical and mental health. Through the event, I've been deeply moved by participants who have reached out to share their story of loss, grief and hope. Together, the people in this room are making a huge impact on mental health. I'm really humbled to be here tonight to receive this award and to be around people of the calibre in this room. I couldn't have developed and grown the Push-Up Challenge without the support of volunteers, my passionate team, some of whom are here tonight, my friends and my amazing parents. Thanks again, and let's all keep pushing for better mental health. Thanks again.
But look, that is awesome, absolutely awesome, and what a great way to really promote wellness and mental health.
Thanks very much. Cheers.
Thank you, Nick. Just an FYI, our awards are on their way from the Eastern States. They're a bit held over with a little bit of a delivery challenge, but they'll be on their way. And we'll continue to introduce the organization of the year that won the Mental Health Award. Altius Group are the leading physical, mental, and social health service provider who specialize in individual and workplace mental health solutions. Their purpose is to deliver better outcomes for more Australians in time of need. They support people in the community and workplaces to be more motivated, empowered, and deliver elevated well-being. We achieve this through innovative, not we, as in not us, but they achieve this through delivering innovative, tailored, and evidence-based solutions. At Altius Group, they listen, they understand, and they're here to make a real difference. I will welcome the entire team on stage and to say a couple of words, only if you're comfortable.
You get about 3 push-ups out of me, I think. We might make a dozen out of a bunch of us, so we'll leave those to you, but a great initiative. And I echo your sentiments that it is a genuine pleasure to be up here in front of a group of people that are incredibly passionate and share that passion that we have for mental health. Firstly, I want to thank Biome Project Services for nominating us for this award. It's something that we are incredibly appreciative of. And we are genuinely honoured and humbled to receive this award from the Foundation. There is a strong alignment between the purpose and the vision of Altius Group and the Foundation. We both strive to increase awareness of mental health issues. We both have a strong belief that prevention and building resilience is far better than treating an injury. And we both certainly want to engage members of the community and ensure that they can access mental health supports. So thank you again for the award. Working as a psychologist or as a group of psychologists is certainly not an altruistic job. It's very rewarding, and if anyone tells you different, they are lying. We are in very much a privileged position to have been invited into the lives, into the homes, into the workplaces of people that are vulnerable and that are struggling. And to be trusted to deliver a service that makes a meaningful difference in their lives. It's something we don't take for granted, and it's really quite special, frankly. It makes coming to work an incredibly easy job. Having worked for myself, for Altius Group for just on a decade, I can confirm it is an incredible organisation to work with, and I'm sure my peers would echo that sentiment. We pride ourselves on really listening and understanding our clients before we develop what is a bespoke, tailored intervention. And it's based on evidence, it's based on what we know works, contemporary best practice principles, and we do deliver outcomes. That's certainly not spin. We don't just say we're really good, we measure our outcomes, we invite feedback, and we vigorously seek it from our clients, and we incorporate any of that feedback into our practice to make sure that we're staying well ahead of the curve. Certainly no secret that a global pandemic has put some pressure on mental health services. We are proud to be recognised for rising to that challenge, where a lot of others in the profession are struggling to meet demand. And it's certainly evident that our activities remain really purposeful. We've remained very focused on delivering genuinely the highest quality outcomes for our clients, and it's a pleasure to do across the community. We really have helped our clients get back to their lives, get back to their workplaces and engage in the community. We're very proud of that. It's very unclear what the next few years are going to hold in a post-pandemic or a slightly post-pandemic environment. But one thing that I can guarantee is that there's going to be a really strong demand for mental health services, not only prevention but for treatment as well. Well, without doubt I can say that Altius is up for the challenge, and we will be here to support our communities, our clients and our organisations, and I would invite all organisations, both public and private sector, to rise to that challenge for the thank you again. Keep safe and please enjoy what's already been a wonderful evening.
Thank you guys, and the work you're doing is really brilliant for you and the organisation. Our next award series is a little bit more, I wouldn't say fun, you guys were really fun, but you know why. It's the WA Schools Creative Writing Competition from 2 age groups, okay? We have this junior secondary category and the senior secondary category. The Mental Health Foundation Australia is committed to improving and initiating conversations at all levels of the society about mental health and the importance of mental well-being. Our Australian Young Writers Creative Writing Competition is an annual event organised by the Foundation to help kickstart conversation about mental health in the school level. This year we have 2 fabulous young writers from Western Australia who have been chosen as winners in their respective categories. Our junior secondary category winner is Jasper Johnson. Jasper is a 14-year-old and majorly interested in music, writing, the LGBTQIA+ organizations, and mental health research, who has a personal lived experience of mental health struggles. Jasper, would you like to come on stage? Yay, come on, Jasper. We have a huge Oh, you got a whistle, Jasper. Okay, you go. Our second category is the senior secondary category, and the winner is Steffi Susan Bino. Mental health is an important aspect of daily life for Steffi, who hopes that through writing it can be expressed that even through tough times there are people to support you. There are ways to reach out and you're never truly alone. Steffi, would you please come up? Oh, she's not here. Oh well, that's okay. We'll move on to the next part of the program. I would now like to introduce Mr. Kevin Mccoy, CEO of Independent and Assisted Living at Australian Unity, who has sent through a pre-recorded address. Kevin Mccoy was appointed CEO of Australian Unity's Independent and Assisted Living Division in July 2017 and has the great fortune to represent almost 60,000 customers across the country's Indigenous, aged care, disability and healthcare services. Kevin spends as much time as possible on the road visiting Australian Unity's customers and its 6,000 employees. He believes it's in his customers' homes, retirement communities, aged care homes, and the remote communities of the company's Indigenous customers that he gets to truly understand how to make a difference in lives of those people who trust Australian Unity with their well-being. Through these travels, he met some amazing people, heard some confronting stories, seen the loneliness, and laughed a lot. This experience has given Kevin an incredible insight into customers and older, vulnerable Australians, while also developing a respect, appreciation, and admiration for the healthcare workforce. In 2019, Kevin was a founding member of the Aged Care Workforce Industry Council, ACWIC, and was acting chair until July 2021. He is also chair of Ramsay Connect, a joint venture with Ramsay Healthcare and a national provider of home and community-based healthcare and support. Please join me in viewing Mr. Kevin Mccoy's video.
Good evening. I would like to start by acknowledging the traditional owners of the many lands on which we are meeting. I'm on the land of the Bunurong people of the Kulin Nation, and I pay my respects to their elders past and present. I also want to thank federal, state and local government representatives, community leaders and all attendees who have joined us today. Your presence demonstrates your commitment to mental health, and I appreciate you being with us. For those that don't know me, my name is Kevin Mccoy. I am the Independent and Assisted Living CEO for Australian Unity. I'm really privileged to be representing two like-minded organisations steeped in a long history of working to improve the quality of life for the community. Across the month of October, a range of events have been organised to foster community resilience as we navigate our way out of the COVID-19 pandemic. For 180 years, Australian Unity has supported Australians through times of war, financial upheaval and natural disaster, as well as in the recovery and rebuilding efforts that followed those shattering events. Today we face a once-in-a-lifetime pandemic, and our response remains the same. Good mental health is vital to our well-being, and at Australian Unity, well-being is at the heart of everything we do. 20 years ago, we conceptualised the idea of a national index of well-being that could be used to track social progress in Australia. The Australian Unity Wellbeing Index has been influential in shaping public policy and providing guidance for governments and other organisations on how they can contribute to improving individual and community well-being. 2 decades of research shows the secret of happiness boils down to 3 things that we call the golden triangle of happiness: good personal relationships, financial security, and a sense of purpose in life. We use the Wellbeing Index as a guide in everything we do, from the products and services we deliver to building real well-being for all Australians. Within our aged care operations, Australian Unity's home care services started developing comprehensive goal-orientated wellbeing plans with its customers to be evaluated and revised at least annually to help them achieve their wellbeing goals. Around 70% of our customers in this area have been upgraded to wellbeing plans from their previous care plans. Over recent years, Australian Unity has been modernising its built form portfolio, with 5 of our current 7 aged care residential homes designed, built and operated to bring to life all 4 elements of our Better Together model. The Better Together model features a strong focus on health and well-being, modular small household footplates, and greater consistency of staff rostered to each household. The model is consistent with the Aged Care Royal Commission's recommendations that good design in residential aged care, particularly for people living with dementia, should involve smaller, lower density, congregate living arrangements, rather than larger, more institutional settings. Our Remedy Healthcare business has provided its MindStep program to more than 2,500 folk. Built around low-intensity cognitive behavioural therapy, MindStep is a 6-week phone and internet-based program that empowers participants to manage their mental health on their own terms and in the privacy of their own home. More than 60% of MindStep participants recovered within 3 months, compared to a benchmark self-recovery rate over 3 months of 23% for untreated patients. Earlier this year, Remedy Healthcare, in conjunction with Australian Unity's Indigenous Services, launched a culturally sensitive adaptation of the MindStep mental health program called Healing Minds. The coaching program is tailored for Aboriginal people, developed by Aboriginal people, and delivered by Aboriginal coaches. Plans are underway to adapt the Healing Minds program for Australians from culturally and linguistically diverse backgrounds. This year, Remedy Healthcare also announced new mental health partnerships with Tasmania and Healthy North Coast Primary Health Networks to deliver early intervention for people at risk of mild mental illness. These government-funded services will support people with anxiety and depression, people experiencing isolation, those in rural and remote locations, and people affected by pandemic-related isolation and bushfires. Mental Health Month is an important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can improve our sense of well-being. Australian Unity is a company founded on social values and community contribution, and we are committed to building and promoting positive mental health strategies. We will continue to identify and help solve the health care and wellbeing needs of the broader community. Thank you.
Thank you, Kevin and Australian Unity, for your continued support. I would now like to introduce Carmela Scafidi, WA Territory Manager at Chemist's Own, our major sponsor for National Mental Health Month, to come and say a few words.
Hi everyone, my name is Camilla and I'm the State Sales Manager for Chemist Own, which is owned by Aratex Pharmaceuticals, and I'm also a registered pharmacist, so it's extra special being here tonight. Chemist Own is an Australian-owned trusted brand in community pharmacy for over 25 years. We are proud to be partnering with Mental Health Foundation to promote better mental health in local communities around Australia, particularly with our dedicated customers, our pharmacists, who are integral in providing support to their local communities every single day. This year's theme of post-pandemic recovery challenges and resilience will no doubt resonate with individuals, families and work teams, as we will personally and collectively be impacted one way or another in the last 18 months. This extends to our customers on the front line, who have constantly been under pressure to continue to serve their local communities during the pandemic, with issues including medication stockpiling, medication shortages, in addition to continuously providing health advice and service to customers. If there is anything this pandemic has shown, it is the resilience of this community. However, what is crucial today is the promotion of non-judgmental discussion around the importance of mental health, and the mission of this foundation to support these discussions and champion positive mental health is a matter Chemist Own supports wholeheartedly. We thank Mental Health Foundation Australia for recognising the various vulnerable communities in Australia and dedicating events to professionals, including discussion of mental health for pharmacists, acknowledging the vital role pharmacists play in our community's response to mental health issues, and recognising the increasing vulnerability they face due to their profession. Lastly, through the annual Chemist Own Help Us Help Our Local Community campaign, participating pharmacies nationally will come together to support this foundation and with us and with their local community through the sales of Chemist Own products until December this year. Thank you.
Thank you, Carmela and Chemist Own. How are we feeling? I feel like we could just spend the whole night together. I mean, it's a Friday night, no, I'm kidding. Before we conclude tonight's launch event, we would like to play 2 short videos on our mental health appeal and our walk for mental health. So please join me in viewing these videos. I promise they're quite cool.
Over 400 young people lose their lives to suicide each year. This number is 400 too many. This year, the MHFA is launching the Mental Health Appeal on the 10th of October, raising funds to develop an evidence-based training program primarily aimed at promoting life and safety in young people. Join us this October in the fight against suicide. Your dollars and cents will help us prevent. Visit our website for more information on how you can support this cause. We're counting on you, Australia. You for a good cause? Then look no further. Join the MHFA as we walk for mental health across the country on the 17th of October at 10:30 a.m. in each state and territory capital. Worried about COVID? Well, we've got you covered. We have launched our MHFA app where you can walk virtually, raising funds as an individual or in a team. Visit our website for more information about getting started. So come on, Australia, our journey to better mental health starts with one step.
They were really cool and short. So we're coming to the end, and I thought we were just getting to know each other, but anyways, the walk, I just wanted to touch on the walk. We have 3 other events happening this month in support of mental health awareness. And the walk is pretty cool because this walk happens Australia-wide on the same day, so each state has the walk happening in Australia, in their own states, at the same time, at the same day, given the time difference. So we have one this year as well at the Perry Lakes Reserves on the 17th of October from 10:30 onwards. So bring your family, bring the kids, bring the grandparents, bring everyone along, because it's not such a long walk, but it's really fun to come together for awareness. There's going to be a fun little opening act with one of my closest friends, so might not want to miss that. We have two other events. We have on the 13th of October, we have the Miners Mental Health Symposium, because and it discusses mental health in the mining industry, specifically with FIFO workers. And on the 22nd of October, we have the mental health of mental health professionals, because how can we forget the individuals that are taking us through understanding mental health? And that's all for tonight, folks. We do have some refreshments at the back, and I would request if everyone can just drop off their lanyards at the table outside. And one last request, final one. Would everyone be keen for a group photo, please? Thank you. We'll just come out at the front and have a group photo. Thank you. I'll ask our photographer to kind of set us up, because he would know what's the best way.
Just